Okay, my presentation today is basically based on my own clinical experience. Actually, it was just by accident that I was brought into all of this. It was like 10 years ago when the product was introduced to me, and I got curious because I am basically a clinician. I do practice in the Philippines, but I'm not basically associated with any hospital because I am into alternative medicine. And alternative medicine is a private practice is in the Philippines. If I need to refer patients, I need to give them to my friends, to my colleagues. But this is a presentation that I showed to some Daiwa people, and they wanted me to show it to you. So I'll show it to you then. Okay, so the objective of this is to provide information about my experience and to give more credence to Biobran as an effective immunotherapy agent in the management of diseases. Excuse me. Before I was into alternative medicine, I was doing internal medicine. And I was in the mainstream, but there was a personal event that happened. My mother got sick. She contracted a tumor, and I wanted her to go through all the works, surgery, radiation, chemo, but she didn't like to submit to any of this, and she chose alternative medicine. And in short, she got well, but even then I wasn't convinced that it was the right path. But she got well, so I got curious. And I found this in the back page of the Townsend Journal. This is sort of the irony of medicine now. The history of medicine, they said, around 2000 BC, we were using roots. And then 1000 AD, we started to use prayer. And then in the mid-1800s, they started to use potion. And then in the mid-1900s, the pill was there. And then we had our fourth generation antibiotics. But still, we're getting more diseases. So now we're back to the roots. So this is now making me think that there has to be something in things natural. So that made me really investigate and be more interested into going towards a different path. And I think a lot of you here are already into alternative and natural medicine, so you are very much embedded in it. You know the principles, but allow me to go to the basics and discuss for the sake of those who don't know much about it yet. So the principles of alternative medicine is quite different from the paradigms of Western medicine. In alternative medicine, we believe that a degenerative disease doesn't happen overnight. In fact, Dr. Rupert was saying, you don't get cancer overnight. You don't get leukemia overnight. You develop it through the years. And also, it is never where it is. Now, this is very catchy because in Western medicine, it's very focused on where the problem is. Most of our treatments are anti. So if you're diabetic, you'll be given an anti-diabetic. If you're hypertensive, you'll be given an anti-hypertension. So it's not really looking at where it's coming from. The main goal of the treatment is to control the symptom regardless of what's causing it. And if the symptom is already controlled, then you're considered okay. But you must maintain your anti-hypertensive if you're a hypertensive patient. And also, another paradigm of alternative medicine is that a strong immune system is a major player in health maintenance, and I believe this. So in our practice, or in my practice, how do I do it? First, we have to determine the cause, because as what we said in the previous slide, it is never where it is. So what is the cause? From my point of view, from what we learn as we go on in the practice, it could either be these two major things. It's the accumulation of toxins and then reintoxication. We have a speaker, Mr. Panos, who is good in the chemicals in the food. But the toxin issue, especially environmental pollutants, like a country like mine, the Philippines, I read data which said that we are the third dirtiest city in the world in terms of lead content. And that is a very toxic substance. And of course, the chemicals, as I was saying, and then reintoxication. So let's go into detail of this. Okay, so that was the environment, and this is the food, and we know this, that where these are delicious food, but this is very high in sugar. And it says there are lots of studies which say that sugar is a potent inflammatory substance, and inflammation is the first sign of a disease. So that's, I don't know if some of you have watched the movie Super Size Me, but he was really focusing on that. And also this one, I tried to cover the names. But okay, so you all know this, and I eat this. I read a study about hot dogs. I read that study like 20 years ago when I went into this practice, and I always tell this anecdote because it's a good story. It said that children who ate more than 12 pieces of hot dogs a month that had the 9 times probability of getting leukemia. And so that's the story, an anecdote I always tell my children, that if you take that much hot dog in a month, you might be sick. And I was expecting them to not eat hot dog, but what happened was they would count their hot dogs. So I would say, oh, it's almost the end of the month, I still have 3 more for this month. So it didn't work. It didn't really work the way I wanted it to work. Okay, so now I don't believe that God created us imperfect. So the body is provided with something to get rid of whatever toxins that gets into, and we all know that's the liver. So the liver is a detoxifying organ, and then the toxins get in, and then it's processed by the liver, and then it's being expelled out. So these are the toxins that can probably get into the body. We have everything there, the pesticides, the environmental pollutants, and then the food additives. And if the food there in the large intestine is not eliminated, then it goes in, and your liver is unhealthy. The liver cannot process it. Okay, so it's incompletely processed, and it makes it more toxic, and it gets back into the system, and it stays in the fat cells because more toxins are fat soluble. In fact, it's the role of the liver to convert fat soluble toxins into water excretable form, because that's how we excrete our toxins, through water, through feces, through urine, and through sweat. Now, in contrast, if we have a healthy intestine, and we have a healthy bowel movement, and we have a healthy liver, it is all expelled out through the kidneys and through the bowels. So it seems that we must have a healthy liver, and our bowels and the kidneys must be in good function. Now, this is the picture of our present-day toilet. And I discovered that the inventor of this toilet was a carpenter. He wasn't a physician, and he did not know the physiology of the body. And where this is for convenience, but that is not good position in terms of detoxification of the colon. You see, this is the ideal pose to do, to defecate, because the thighs will press on the 2 areas which is most commonly the site of the cancers. And they found out that these 2 areas, when we are sitting, there is no pressure here. Okay. So this picture is a picture of a book by Dr. Bernard Jensen. I don't know if you know him. He's a very famous naturopath in the States, and he did colonics therapies. And I really find this very interesting, and I always show this in my slides. Now, this is a picture of an infected foot. If you remember one of the paradigms of alternative medicine, it is never where it is. And if you go to Western medicine management, you would go to a dermatologist, and then she would give you the creams and the antibiotics for it. But if you go to an alternative medicine doctor, I will not even give you the creams. It would be a challenge to look for the reason why you have that case. And first, as we were saying, we should be assured that the colon is functioning well. So this is what happened. When he detoxed the patient, like do a colonics or enema, he was able to remove this much fecal material from that patient. And this is what happened to that skin picture on the 4th day, not directly treating the skin, but treating or evacuating a very long tube, which is the intestine. And this is this is what they do. Of course, we all know that we must have high fiber, we must have enough water, and then you can do enema. Dr. Jensen in his book says we should be moving our bowels 2 or 3 times a day. But I don't do that either. Okay, so this is the 7th day of detoxification, doing a colonics only. See, he was really able to reverse the skin picture just by cleaning the colon. And I see it in my cases also. I just use this one because it's a very good picture. I'll show you some of my pictures later. So it is never where it is, therefore. So based on this principle, we can surmise that alternative medicine has a different paradigm from allopathic or the Western approach. It is not symptom-oriented, but cause-oriented. And if in allopathy we are given medicines to make headaches disappear, in alternative medicine, we should accept the challenge of finding why there is a headache, or why there is high blood pressure, or why there is high sugar. And if treatment, therefore, is cause-oriented, it means it is looking at the disease as a result of the cause, not as a symptom. So you should look for the cause. So we cannot say you have cancer of the lungs, this is specific for the lungs. Holistically speaking, it's always a challenge to look for the specific, what could be causing that one. Because, you know, in the early days of my practice, I was really very more of, what you call that, box type of therapy, like, oh, this one is the protocol for this, and this is a protocol for this. But as I go along, I don't see that it works all the time. And even the principle of getting a healthy lifestyle. Like, for example, this morning, I just read Jobs, Steve Jobs. He was a pescatarian. He was a fish eater and vegetables only. And yet he had cancer of the pancreas. That is going against the principles, the dogma of alternative medicine being purely vegetarian, being free of chemicals and all. Now, I had another patient who had cancer of the lung. She wasn't a smoker. And why did she get all this? So all this information come into mind, and it makes me think, what is really the problem? I guess it should not be viewed as one single entity. It should be looked at as from the whole holistic perspective. Okay, so we're saying this is a cause-oriented. We are looking at the cause. Now, if we are able to identify the cause, so of course we know the basic diet. Everybody knows a toxic diet is not really good. But I don't also believe it has to be very, very strict, that you cannot anymore eat or enjoy life, because I see that there are people who are very strict and yet they still get sick. I think the key is moderation and everything, and let the liver do its job of detoxifying. And I read, and I know I really wanted to dig up that article which said that it takes around 72 hours for the liver to clean up. So I would tell the patients, okay, if you want to eat something nice, maybe once a week is not really a sin, but do not overdo and eat it every day. And then once we have, okay, so we go for the liver, the intestine, we look into this. And this one I will discuss later because I'm very interested in this. And the nutritional supplementation, we give, of course, the nutrients and the IV nutrients, because I forgot to show that the liver can only detoxify if it is complete in all the nutrients, especially in the production of glutathione, which is the main molecule necessary for the conversion of the toxin into excretable form. So nutrients are very important, or your antioxidants, you say. And then, of course, the Biobran, or the immunomodulatory substances. Okay, now I was telling you about the diet. So no meat, no sugar, no fried foods. But sick or not, we are told that this is a good dietary lifestyle. Yet, after 20 years of practice, I have encountered patients who have been meat eaters and they love Chinese food but live healthy up to 90 years. And there are vegetarians who also get serious diseases. So my advice is moderation and monitor. So the nutritionals, it would be ideal to identify what are the deficiencies in that particular patient. What is the vitamin that is deficient? What's the amino acid? I know in the States we can do all these panels, but in my setting, I really have to do a widow, and I just more or less deduce. Okay, I'll give this one, and probably she will get this much amino acids, and so. The Philippines is now a very big producer of moringa, which we call malunggay. It's rich in chlorophyll, so we give that. You know the wheatgrass, you know the barley, you know chlorella, you know spirulina. All foods rich in the greens. This will take care of my nutritional needs, and then I monitor them every 2 weeks and see if something is happening for the better. And then in some patients, we have to give intravenous vitamins. And we give as much as 50 grams of vitamin C. It depends on the improvement of the patient. And then we start to give the Biobran. Now, why did I become very interested in the Biobran? Because when it was first introduced to me about 10 years ago, I had a case of Wilms tumor patient. He was a 7-year-old child, and he had chemotherapy. But the parents came because his WBC was really going down. Every time he went through his chemo, it would go down. And he had radiation as well. So this is him before, in 2002. And this is the picture of his WBC count. We initially gave 1 sachet a day. And the WBC, after radiation or chemo, it was 3,600. And then after 2 weeks, it was still low, so I went up to 3 a day. And you notice that when it became 3 a day, the WBC started to rise from 2,400, 2,900, 3,190, and up until he finished the radiation and his WBC count was within normal range. So he was able to breeze through the radiation and chemo without any side effects. This is what Dr. Hubert was saying, integration. And this is him now. He is a varsitarian, his school basketball team. This is 2010. Okay, so this was discussed completely by Dr. Rupert. So we'll skip that one. And yeah, the NK cells, and it's the NK cell attacking a cancer cell. And so, we know this one. Biobran is clinically proven to help powerfully enhance depleted immune system, effectively increase the NK cells around 300% or probably more, significantly boosts natural antibody production, is an anti-inflammatory, antioxidant, enhances pancreatic function, and even increase glucose tolerance. Enhances liver function, reduces adverse effects of chemotherapy. I really like this one. In the Philippines now, I have quite a number of oncologists working with me. After a chemo session, they send their patients to me because we have usually a 21-day gap for the next session of the chemo. And then they send the patient, okay, rejuvenate him for the next session. So we finish the whole recommended session and the patient doesn't really feel very weak or any reflect with the side effects. So the dosage of the Biobran, this is the recommended. But as Dr. Rupert was saying, you cannot overdose. So I also like to give a lot of NKCP, Biobran. So it's my experience that it's very effective. Now, these are supposed to be the tumor markers that we can use in the Philippines available to us, but it is also quite expensive from our point of view. I found out that there is a test that we have there available. We call it the beta-HCG test in the urine. It's a measure of a certain molecule in the urine that is supposed to increase if there is a cell in the body that's rapidly dividing. Supposedly, if you have a fetus, you have high of it. But if you're not pregnant and you have high of it, then there must be a cell that's rapidly dividing in your body. So we use that because it's very cheap. It's only around 500 pesos per test. So I started to, because I got interested with the child, I started to use the HCG as a monitoring parameter for the efficacy of the Biobran. And this is what we got, no? So first 2 weeks and then second 2 weeks, so I tabulated all their HCG reports. And for a total of 25 patients, we made it into a graph, and this is the result. So this is the number of weeks. This is the HCG count, because the higher it is, the more is the possibility that you have a cancer. So this is the first week, and after 2 weeks, this is what we got. It's only my compilation of patients. It's not really a research study or something, but it just really made me curious and more interested, and be bold in using it more and more. And so that we use the beta HCG. Now, after using it with the cancer patients, I started to be more explorative. So I deviated not from cancer, but this time for psoriasis patients, because it's very difficult to treat them. And there are patients we have explored and exhausted all possibilities, and still they do not respond. So when I started to use the Biobran for psoriasis, I was really impressed. No? So this is a psoriasis at the back. This is January 2010. This is a picture again in February and in April. So you see, it has a very negligible lesion already. Now this is another case. It's a non-healing stasis dermatitis, and it's very difficult to treat as well. And it was very effective for her. In a matter of, I don't know, let me see. Oops, sorry. Okay, so November 3 and November 26. So that's around 3 weeks only. And the patient really got well. You know, if only I would give everybody Biobran. But it's almost always the last choice because of the cost. Because it's very good, and it's non-overdosing, and you know, you'll get all the benefits. But you know, that's the only hindrance for me using it all the time. And this is another case of herpes zoster, an 80-year-old woman. The before is we had so much pus in there, and then after a certain period, like 2 weeks only, the scab has already formed. So from then on, I started to use it for this herpes patients, shingles, you know. And this one is a very good case, because this is a case wherein she had a blockage of her lacrimal duct, you know, the passage of the tears. And her doctor inserted a tube so that you can have a sort of a canal that the tears can pass. But what happened is she developed a tumor when that tube was in there. And this is the string that's supposed to attach to the tube so that the tube can be easily pulled out. But when the tumor started to grow, they were afraid to pull out the tube. So she was advised, they did a biopsy, it's positive. And she was advised to go through radiation, chemo, but she opted not to. So this is November 2009. I pressed, okay. So here she is. Okay, so April 12, 2010, you can see the lesion now regressing. And I took this last month only. So see, it's totally out. In fact, they were able to remove the tube. So you can see the comparison. November 12, 2009, and then August 20, 2011. Now, this is another good case of psoriasis again. You can see the hands, it's full of pus and lesions, and she was really unable to do anything or even walk, because even the feet and the plantar area is full of pus. We did everything. Everything that I know that's good for psoriasis, it didn't work. So finally, I decided maybe I should give Biobran, but how much? And so you know how much I gave? 1 sachet every hour, every waking hour. But look at the effect. Look at the effect, see? These are the hands that were so full of pus. And I have the video.
My name is Rika Estrada. I'm a patient of Dr. Lao. I've um, I've been using Lentin for the past um, almost year since I got an infection in my psoriasis skin condition, and the Lentin has um, helped a lot and has healed the infection in a very short amount of time. And I've been using it to maintain my psoriasis, and it's almost completely gone now. Thank you, Doc.
Okay, so these are her hands now, and she's back to work. So the comparison, one sachet every hour. You know, when I first told her she should use it, of course she would complain of the cost. But when she got well, she would not let me stop. Or she would not let me gradually wean her. She was so afraid it would come back. So never mind if it's expensive, she would really use it. You can see it's a big difference. See how clear her hands now. Here's another case of psoriasis and the after. So this is one sachet 3 times a day, before and after. Now this is another case. This patient is a cancer survivor, cancer of the breast. She only had an infected pimple. But you know, with cancer patients, I am very fearful when there are signs of low immune, because they will be very susceptible to be having a relapse. So I gave her right away 1 sachet 3 times a day for a week. And so see, very fast. So 3 times a day, and then before and after. Oh, this is my famous picture. Okay, let me tell you the story of this lady. This is like 2000. See, I was just using Biobran in the early days, in the early days of my use of Biobran at that time. This is a case. She is a professor in a well-known university in the Philippines, and in fact, she is now the teacher of my children. My children then were little. And this case was, unfortunately, when I present this, I cannot present the biopsy, because this is a case she would not submit to any Western intervention, because she said she read all the books and she studied it well, and she says, I will take responsibility, no Western medicine. So she would say, okay, just take care of me and I'll do the rest. So what happened was, okay, we'll do this. She started with a mass this big, very small. But she was a lecturer all over the world, traveling here and there. In other words, very busy. So she did not take care so much of her tumor. And then when she came back, it was already big. It wasn't erupting yet, but it was big. So we did the things that I knew that should be given, but still the mass continued to be big, and until such a time that it really started to erupt. And that's when the Biobran came in. So I started, you know, it's not just Biobran. I mean, you know, managing a case like this, it's not just that. It's just only, the Biobran is only the immunomodulator, but so many other things you have to consider, holistically speaking. And she would say, okay, you take care of that, I will take care of the rest. And what the rest would you mean? My relationships. You see, the emotion part, the spiritual part. She believes so much that it has to be taken care of also. Anyway, it took us this much. This is after 6 months, and this is after a year. Now, one thing good with this, not really good, but one thing outstanding with this is she was so sure she would get well. And she was the one, you should take my picture because you will use it in your lectures. So she was so sure she would get well, but it was even me who said, oh my God, I really wanted to bring her to the hospital already, because, you know, that lesion, and she was carrying it like 2 kilos of meat on a daily basis. But another thing, she is single and she was living alone, so she would clean it every day by herself. And she would prepare all the food that she knew was good. I don't know, this is an isolated case maybe, but it's a good case in point for people to have hope and then to know that it can probably work. And she is okay until now. This is 2003. And now, what is now? It's almost 10 years now, so she's good. one thing, academically speaking, I don't have a biopsy. Because in practice, you have the choice of being academic or being pro-patient. I would really wanted to document the case, but she was adamantly saying no. So of course, I would let her be. And so, as a conclusion, although we cannot deny the value of detoxification and nutrition in the management of diseases, Biobran is the top-of-the-line immune booster. It's not because this is a Biobran seminar. I really believe in Biobran. Yeah. In the first place, I did my own study without even them knowing that I have that. I just accidentally showed it to Dr. Gonum when he went to the Philippines, and he was quite impressed with what I had. But it wasn't a study that, okay, we will finance you and then talk about Biobran. No, it was on my own. So it is therefore, without doubt, very important that a patient undergoing any type of treatment, Western medicine or alternative, Biobran should be a part of the regimen. Now, as an addendum, I was mentioning about the emotion. Because in Chinese medicine, there are emotions that can weaken specific organs. And liver is weakened by anger. Lungs is weakened by grief, stomach by worry, kidney is fear. Many other more, but these are major organs that I really want to focus on because this is what I see on a daily basis among my patients. Because there are so many cases that I try everything and nothing works because they have so much anger in them. Now, there is a picture here. This is, what is this? These people are about to ride a roller coaster. Okay? Now, if you ride a roller coaster, what would you feel? Fear. Correct. So, they were riding the roller coaster, and look what happened to her. So, what's the organ weakened by fear? Kidney. So, look at this. Okay, so it's very concrete. If you watch the movie Ransom, the child peed when he heard the voice of the kidnapper. So it's very concrete. It's really correct that there is a connection in the emotions. So holistically speaking, it's not only one. Well, in practice, in a clinical practice, it's different when you do research, science. That's very helpful from the doctor's point of view, but from the patient's point of view, the clinical approach is different. So, therefore, I have a recipe to a good life. 2 cups full of sincerity, a heart full of love, 2 hands full of generosity, a dash of laughter, sprinkle with kindness, and serve everyone you meet. Thank you.